Well, welcome back, everyone. You know, November is Lung Cancer Awareness Month, and today we have Kristin Hoehn, certified nurse practitioner, with us to share more about this month and life-saving screening. So thanks so much for joining us, Kristin.
Thank you for having me.
All right, so can you share just a little bit about the prevalence of lung cancer in our country and our community?
Yeah, so lung cancer is actually the most deadly cancer in the United States. It is more deadly than, colon, breast, and prostate combined. And so actually here in Allen County, we have a higher than national average of lung cancer. And so we're trying to get the word out, about lung cancer screening and the importance of getting that screening completed just here in Allen County, but, in Ohio, statewide.
Right. So diagnosing and staging lung cancer is of great importance. So can you explain why?
Yeah, and so, the earlier the stage that you catch the lung cancer, the, longer the 5-year survival rate is, or the higher the survival rate is. And so the earlier the stage, you get about a 63% survival rate, to where the higher the stage, you get about a 9% survival rate. And so here at Lima Memorial, we're trying to catch those stage 1 cancers, so that way we can, greatly increase those survival rates to get that 63%.
Right. Now, you just mentioned catching those stages. So what is Lima Memorial doing to help find lung cancers at their earliest stage?
So here at Lima Memorial, we offer the low-dose CAT scan. And so what that is it's about 80% less radiation than a normal CAT scan. No IV, no dye. It's done as an outpatient procedure. And so you come in, we essentially put you on the CAT scan or run you through the table. And that gives us an image, and it tells us, are there any nodules, any enlarged lymph nodes, anything that would be suspicious for lung cancer. And then if there is anything, then whoever that ordering provider is, if it's, high risk, we call that provider right away and let them know, hey, there is something suspicious. You need to do something about that.
Right. So is this new technology, is it aiding in early stage diagnosis?
It is, yep. And so that way, if there is something, we need to do something about it right now. Or if there's something that maybe we need to watch, it tells us, in a category, is it something that we need to watch in 6 months? Is it something that we need to do something about in 3 months? Or is it something maybe we should biopsy a little bit sooner?
All right. So if an individual thinks that they might be a good candidate for a low-dose CT lung cancer screening, who should they contact?
First, I would start by talking with your primary care provider to see, are you a good candidate? Are you a current smoker? Have you stopped smoking in the last 15 years? Have you smoked a pack a day for the last 20 years? Or have you smoked more than that? And see, are you a good candidate for this screening test? And if you are, we can always get you scheduled. There's a number at the bottom of the screen as well to see, go ahead and get you scheduled. If you're already a patient with, a specialty provider, we're more than happy to get you scheduled as well.
All right. Well, I want to thank you so much for joining us today. I appreciate it.
Yeah, thanks for having me. I really appreciate it.
My pleasure. All right. Well, don't go away because we have more when we return.